We're live now, and I hope we are because
30 seconds, Senator, 30 seconds.
Okay.
She's live now. She's live now.
All right. Welcome to the Senate District 9 Town Hall. I'm Nancy Skinner, your state senator, and we've been having a series of these since it's not the right time, given our pandemic, COVID, for us to have in-person town halls. But we've been trying to hold these. My staff have been incredible, putting together really good experts on various subjects that we've all been dealing with in this pandemic. And today we have, as California has been now for a number of years, in addition to our dealing with COVID-19 virus and all that entails with that, we have our terrible fires. And I think most of you know, I forget exactly the number day, it's 22nd or 23rd day straight of bad air quality in the Bay Area due to the fires. And as I think most of us woke up this morning to the very, very dark skies, we know that we're in this for a while. So today's town hall, we have some wonderful folks who have joined us. We have Dr. William Walker, who is with the Contra Costa County Health Services and has joined us in the past and has been really wonderful with updating us on new developments regarding the pandemic and how our counties and the state are, what type of, what businesses are being allowed to be open and which aren't, and various other things. So Dr. Walker is going to share with us updates on the pandemic and the different activities that we are allowed to engage in and whatnot. And of course, always wear our masks. And then we have Captain Pace from Alameda County Office of Emergency Services, who of course will talk about the fires we're dealing with now. And we'll even talk a little bit about evacuations, because while we don't have a fire currently, that is creating a circumstance where anyone within Senate District 9 would have to be evacuated. I think most of us know that the absolute worst fires in the state in terms of loss of life and structures before this last 4 years of terrible fires in California were right here in Senate District 9. In the Oakland-Berkeley Tunnel fire, and we had to do an enormous amount of evacuation. And we've had to since then at times. And so we may again this year. We hope not, but we may. So we'll talk a little bit about that and a couple of other things. And then we will hear from our insurance commissioner, State Insurance Commissioner Ricardo Lara, who is now the head of our Department of Insurance, but who also served with me in both the State Assembly and the State Senate. And I will tell you more about Commissioner Lara when we get to that spot in the agenda. But now I would like to turn it over to Dr. Walker. Dr. Walker, give us some update on COVID. And then if you want to give us if you want to integrate any of the issues around the fires and smoke also, please do so. And thank you so much for joining us again.
Thank you so much, Senator, for allowing me to speak today. As everyone knows, we're now well into the COVID pandemic, and the ongoing effort of the state and the counties to work together on this approach to curtailing the virus and helping to allow our folks to resume normal activities. And as you know, there has been to date what's called the state monitoring list, which has basically allowed counties who were on or off the monitoring list to open various types of activities before other counties. And this has led to some confusion over time. And I think finally, we have now a new program that the state has announced and actually begin on Tuesday of this week, which is called the Blueprint for a Safer Economy. And what it does is basically provide a much clearer structure of how counties can begin to open up various sectors of their business and personal activities as we gain better control of the virus in the counties. And there's a new system that's basically a color-coded system: purple, red, orange, and yellow. And currently, most counties in California are in the purple area, which means that we all have a ways to go. And the status in each individual color is determined by two factors: the number of new cases per day per 100,000 population. That's new cases of COVID per day per 100,000 population. And the positivity rate. That means that of the number of tests being done, how many of the tests are positive for COVID. And currently, to be out of the purple range, you have to have a new case rate of less than 7 and a positivity rate of less than 8%. So for example, Contra Costa at the present time has a new case rate of 8.4, which is not less than 7. And our positivity rate actually is better. It's 5.3%, but even having one factor better doesn't get you out of the stage. And so we'll be in the purple range in Contra Costa for another 3 weeks at least. And this will be measured again next Tuesday the 15th. And every Tuesday thereafter, the statewide numbers are published to determine in what color category each county will be. Alameda, by the way, also is currently in the purple category, and actually often also trying to improve its positivity rate. Given that, nonetheless, I think we in Contra Costa and Alameda and the Bay Area are making good progress in terms of some of the other important numbers. Our death rates are beginning to stabilize. We've had 187 deaths in Contra Costa. 108 of those have been in long-term care facilities. But in August, for the first time, the number of folks who were living in the community, not in long-term care, died in a number that exceeded those in long-term care deaths. At the present time also, our hospitalization rate has come down. It was running in the 95 to 100 range for quite a while. Today it's down to 62 in the hospital. And we were using, we have 41 ICU beds available in Contra Costa, which is also a good number to have. And so from the point of view of overwhelming the healthcare system, we're also in very good shape. Now, what being in the purple status also means is that our schools cannot open to in-person learning. We have to be on remote learning until you're out of the purple range. There's one exception to that, and that includes the elementary schools. And there's a system in place whereby individual elementary schools can apply to receive a waiver to open up if they meet certain criteria and have testing available and are able to do the kind of social distancing and masking requirements that would be required in the schools. So far in Contra Costa, we've had 22 applications for those elementary schools. 10 have been approved by the county and sent to the state, and the state has approved 4 of them. That said, they are all small private schools, and there's no public schools yet in Contra Costa that have made an application to open. So with regard to further opening up of our economy and getting back to school, we need to get out of the purple range. And hopefully we'll be getting out of the purple range, hopefully by the 22nd of September, we would hope, which would mean that schools could open up on the first week of October if that happens. So briefly, that's where we're at. I'm open to any questions about that. So.
Certainly. Thank you, Dr. Walker. We put out the word for the town hall, and we asked folks to submit to us questions in advance. And I did receive a few questions, so let me ask those to you now.
Sure.
One of them relates to the fact that, and while you did not relay this, it's been in the news, that the highest COVID cases now in Contra Costa County are in the two of the cities in Senate District 9 in West Contra Costa County, both San Pablo, and Richmond. And the cases where it's highest is amongst our Latino residents. So the question that we received is, people want to know, what is the county doing to specifically target our Latino communities and residents to make sure that we have provided culturally relevant and language-specific materials and outreach, since we are seeing, not only the data in California-wide and nationally, that we have a disproportionate number of COVID cases and deaths amongst our Latinx community, but also specifically right here in Richmond and San Pablo.
That's exactly the case that's happening in Contra Costa and many other counties around the state. What we do know is that the impact on the Latino community, the Latinx community, has been a couple of factors. One is that many of them work in essential work situations, working in our food facilities, our grocery stores, our service industries, where they really cannot work remotely from home, and they have to work to keep the lights on at home. The second is that many also live in households which are in rather crowded conditions, where you have more people living in the household than in other households. And that does not allow for good social isolation for those determined to be COVID positive. When our contact tracers actually find folks who are living in such situations, we do offer the ability to live in a hotel room during the time that you might be infected.
So if that is available, and we know that not everyone gets contact traced, how would a resident be able to find out about if they have if they themselves are living in a household with a lot of members, and if they needed that, who would they contact?
They would contact the Contra Costa County Health Department, cchealth.org. Would give you the number for that. The contact tracer themselves, when they find a positive case, always offers the ability to have such a hotel room if it's desired. What we find is that there's relatively low uptake, and only about 12% of our available hotel rooms are currently being used. So we certainly have the capability to do that. Okay. Beyond that, you spoke of outreach to the Latinx community. We're doing that in terms of our not particularly working with our community-based organizations, the folks who actually know their way around the community and know how to communicate. We're doing that, and we're also currently working with the Bay Area-wide public health information officers to try to work more with the Spanish-speaking media to actually get out with the uniform messages around the Bay Area. So it's a struggle. It's something that communication itself won't help. It really involves safety in the workplaces, the kind of masking that people need to be doing when they're working, even in crowded facilities, and the kind of social isolation that needs to be done once we know we have a positive case.
Right. Well, my office may follow up with you, because we may want to get some information out to our constituents, because certainly no one has to take advantage of the hotel rooms that are being offered, but it might really help some families in terms of minimizing the spread of COVID just in their own household or in their neighborhood. So thank you for that. And then I have another question for you. Sure. And that is, and this one is interesting because I know that what's been on the federal CDC website has not always been let's say, the guidance that we have gotten from our public health directors in our counties and also in the state has not always been 100% consistent with the federal CDC. But lately, what some constituent wrote in, and I didn't do a fact check yet, but what they said is that recently the CDC reclassified some data on COVID-related deaths and basically dropped the number of deaths. And so this person's asking, was that accurate? And if so, would that impact then how our counties are responding?
Actually, it doesn't impact our death reporting in California, which is pretty straightforward with regard to the relationships of deaths and death certificates and reporting to the state in an accurate manner. We've heard the argument from some in the federal government and elsewhere that many people are dying with COVID and not necessarily of COVID. And I think that's a misinterpretation of the fact that death certificates often list coexisting conditions such as high blood, diabetes, etc. But primarily the people who are dying of COVID and have those listed on the death certificates are not dying of hypertension or diabetes. They're dying of COVID. And so we need to kind of try not to minimize the impact on our communities and in people with coexisting conditions by saying that they were going to die anyway, which is what they're kind of making the statement about. So we don't subscribe to that particular opinion, but you can trust the death data that's coming out of local health departments in the state of California.
Thank you. And I'm sure you'll have some other comments that you may want to make as we move into this next section. And I want to
one quick comment, and that is that data that have just come out this week is really pointing to the fact that masking is eminently important, not only to protect other people, but protect yourself. The data is coming out that by simply wearing a cloth mask, you can diminish the amount of virus that you're exposed to, which would lead to either a case of no symptoms or a case of very minimal symptoms. And so you are protecting yourself with a mask, and it's not just protecting others. So please wear your masks. Thank you.
Dr. Walker, I'm really glad you brought that up. I mean, I have masks all over my house so that, because I find myself, even with being in the habit of using them, that I go outside sometimes, close the door, and then realize, I forgot it. So I have them all over so I won't forget. I have them in my vehicle. I even have some on my bicycle. And just like you pointed out, I have been reading these latest reports that show that if we are masked, even if we are exposed to the virus, it may cause us to get a much lighter case of the virus, which obviously, look, none of us, unless you've had COVID already, are immune. And even if you've had it, we don't fully understand yet how long your immunity lasts. And I'll use a term, it's called viral load. The amount of virus that you're exposed to, how long you're around someone who may be shedding the virus, how much exposure you have, and how much of that virus load or viral load you yourself experience, you breathe in, will often determine either whether you get sick at all or how sick you get. So clearly masks are just the best thing. They're the best thing to protect ourselves, our families, and others. So yes, masks, masks, masks.
Thank you.
Now, and thank you. Captain Stokes, thank you so much for joining us. Captain Stokes, you have been involved with Alameda County and the Office of Emergency Services there, as well as search and rescue units and others for a long time, I think 23 years. So I think that you clearly have a passion for emergency management, and we are in a number of emergencies right now. We are in the COVID-19 emergency and a terrible fire emergency and an air quality emergency. So what can you share with us now on how to keep safe, and then plans and preparations? And then I'll have some specific questions for you that constituents submitted.
Sure. Thank you, Senator. Just a brief update on the fire, the SCU complex fire. I think most of the listeners will know that is the second largest wildland fire in California state history. It is essentially out in Alameda and Contra Costa counties. It encompassed 5 counties, impacted 7, but it is 95% contained as of today. And all evacuation orders and warnings have been lifted for that fire. So good news for our immediate area on those fires. Of course, we've got dozens of other fires that are just starting or are well in the burning stages throughout the state. And we saw, especially today, some of the air quality impacts of the fire. Over the last week or so, we've really smelled the smoke. Today, at least out in Dublin where I am, I don't smell smoke so much, but you can see that the change in the color and the density, and definitely see a difference in the way that the smoke is impacting our area here. Just by way of reference for the fire, in Alameda County, we evacuated about 1,000 individuals, and an additional 20,000 were put under fire evacuation warnings. We did something different this time related to COVID, in that we housed our evacuees in hotels as opposed to congregate shelters such as high school gymnasiums or the like. And so that way we had the social distancing aspect. They stayed within their social bubbles or their families to not exacerbate one disaster with another. So that made things quite challenging. Not so much in Alameda County, but in many other counties where they evacuated tens of thousands. We were, again, prepared to evacuate tens of thousands. Fortunately, we were limited to about 1,000. Of those 1,000, we were even more fortunate in that the vast majority of them, as is often the case, found their own housing. They went to friends or relatives' houses, or they rented hotels of their own. In the first wave of evacuations, we housed 11 families. And then in the second wave of evacuations, we only housed 2 families. We're a little bit further into the fire at that point. And I think most of the people that were going to evacuate already had. And so we only had a couple of additional that we needed to house.
So are we prepared? Sounds like in that circumstance, it was definitely adequate hotel rooms and such. The population is a little less dense in the area where you had to deal with. In Senate District 9, where I'm sure there's folks who are listening to this town hall who do not live in Senate District 9. But for your familiarity, as you know, Senate District 9 has Oakland, San Leandro, Berkeley, Emeryville, Alameda. Now, obviously, our wildland interface area are the Oakland Berkeley Hills, some parts of San Leandro, and of course, not in Alameda County, but Contra Costa, Kensington area, Richmond Hills, Richmond Annex. Now, we could have a fire anywhere. Obviously, we have other issues like refineries and such, but the areas where we have are typical for this type of fire that are just from wildland impacted are pretty dense compared to what you just experienced. So if we had to do a large scale evacuation of, say, the San Leandro, Oakland, Berkeley Hills area, what does Alameda County have in place?
Sure. So that is actually one of the things that we faced with this fire, in that it was headed in towards Fremont, where they were over by the Ohlone College area, off of Highway 680. Where there were about 5,000 residents there. Still not quite as densely populated as the areas you're talking about, but very much residential. And so we did enact some of these plans. And for that many, we would have to go to a combination of congregate sheltering, the more traditional style sheltering in the community centers and the gymnasiums, as well as hotels. And so we work very closely with the Red Cross and our partners in our social services agency, who actually run our care and shelter branch in the Emergency Operations Center. So the Red Cross has agreements with 50 hotels throughout Alameda County, just in Alameda County, where they have pre-written agreements to use those hotels. There's obviously more hotels that are available than that, but those are the ones that they have pre-written agreements with. We also have plans for how to set up congregate sheltering in a COVID environment, to where we are socially distancing. The cots would be further apart than they would normally be. We would house a fraction of the number of evacuees in each individual shelter compared to how we would normally handle that. So we do have other plans, contingencies, when the hotels were to fill up, to be able to house in other COVID safe manners.
Now, I'm sure there were folks like this in the area that you already evacuated, but we know that a good portion of the area that I mentioned has senior residents, some who are disabled, some very high medical needs, and then just generally we have folks with disabilities. And so how does the county plan for that? So if we have to have an evacuation, how do we already have, do we work with the cities who may know? How do we deal with that to ensure those folks' safety?
So absolutely, we work very closely with the cities. We have a saying in emergency management, and that is that all disasters are local. So no matter how large a disaster is, the response and the responsibility for the disaster is at the local level. So it's first and foremost with the cities in the incorporated areas, and then of course with the county in the unincorporated areas. In a large scale disaster, those cities will fairly quickly exhaust all of their resources and need to scale up to the county and then potentially to the state and the federal government. And so all of our plans address access and functional needs. The various evacuation plans and animal plans and transportation plans all address access and functional needs. And we work, again, closely with the Red Cross and the Care and Shelter to ensure that we are meeting those needs. For instance, we work with paratransit for transportation issues. We work with FAST, which is the Functional Assessment Support Team, who would assist the county and the cities in assessing shelter facilities to determine, perhaps a wheelchair ramp needs to be installed here, or we need additional outlets for different medical machines and things like that. And so they would come in and provide support for the jurisdictions as they address the needs of those with access and functional needs.
Great.
Yeah.
And I'm going to ask another question that, so, fortunately, as you mentioned, the fire that was closest to us is contained and under control, but we know there's many, many more raging. And we also know we're hearing that there's high winds predicted. And it was, of course, a very high wind situation that led to the Oakland-Berkeley Tunnel fire back in '91. My question is, when we face these conditions, the utilities will often do the power shutouts. So we knew last year and the year before, we had quite frequent what they call PSPS. And Dr. Walker, if you have any information you can jump into, we got a load of questions regarding that. Like, number one, are cell towers now, are they better protected so that people will still have a working cell phone if we have these power shutoffs? And what other things may have been put into place from our experience last year and now if we experience these power shutoffs, so that we know that we can be safe or alerted under the emergency. And Captain Pace, we'll let you go. And then Dr. Walker, if you have any information, jump in.
Sure, great. So we work closely with PG&E, who is, of course, the main supplier of energy in Alameda County, and I believe Contra Costa County, and largest in the state. And so that is generally who would be shutting off the power. Even in the city of Alameda, which is their own municipal power, they get their power primarily from PG&E, so they would still be impacted if PG&E were to turn the power off. PG&E has substantially improved their process of communicating with the local jurisdictions. They're providing us much better real-time information. They're much better at notifying us in advance. They had a plan in the past for how things would work, and the plan did not usually, or the execution did not often go as planned. This year, we've actually faced already the first PSPS event. Fortunately, neither Alameda or Contra Costa counties were impacted by that, but I believe I read today that 22 counties were impacted by the PSPS. And so they have a web portal for government agencies to be able to access the specific grid and sections that will be de-energized so that we can best prepare and plan for that. They share with us what they call their medical baseline, which is their list of customers who receive discounts for certain medical conditions, which means that generally speaking, they need electricity or cooling or heating in order to maintain their health. And so they provide that in a HIPAA compliant way to our medical health branch in order to monitor and make contact with those individuals. PG&E reaches out directly to those customers and informs them of the impending PSPS de-energization, and then again notifies us of who they've made contact with, what type of contact they made, whether it was a positive contact, meaning they actually spoke to an individual or someone confirmed, or if they just left a message. So that then allows the local government to follow up with those individuals that were not contacted.
Right.
We also, from the public health side, and I'm sure Dr. Walker can perhaps add more to this, have access to the medical, I just lost the word for it, but the federal Medicare, the Medicare files for people who are using or who have durable medical equipment that relies on electric power.
Right.
And so in Alameda County, we are in the process of purchasing battery packs to be able to loan out to individuals that we are aware of that are on these lists of needing electricity to power these durable.
So when you mentioned we're in the process of purchasing them, does Alameda County or our cities have it now? So in other words, we could have a power outage in the next couple of days. And you pointed out, and I have noticed, PG&E is alerting people more in advance. They did inform, I heard it on the news, for example, that it was Napa, a couple other counties nearby that might experience a power outage, whereas Alameda County and Contra Costa wouldn't. But so maybe a quick answer on whether you have some of those available now for Alameda County residents, and then perhaps Dr. Walker, you can add. And then I want to get back to cell phone towers before we go to Commissioner Lara. I want to know whether people can feel confident that they're going to have cell service. So go ahead.
So in Alameda County, we have not yet purchased them. So we do not yet have the battery.
If we have a power outage in the next 3 or 4 days, people could turn to their city, but right now they couldn't turn to the county.
For something to take home, correct. But for recharging centers, things like that, cities, the county, as well as PG&E set up community resource centers.
But will they, but with COVID, will they this year?
We have not been told that they're not. They will need to comply with the COVID restrictions and the guidelines and the social distancing. But as far as I'm aware, the plan is still in place to set up those stations.
Okay, all right. And Dr. Walker, and then we'll quickly check in on cell phones.
Yes, I won't be long. Captain Stokes has really very well covered the public health aspect, particularly with regard to those who are most vulnerable in the community in terms of being on medical equipment or needing oxygen, those kinds of things. And we have the database. We have not only from PG&E, but also from Medicare and the durable medical equipment providers, so that we actually have an automated way ourselves through the medical health branch to be able to call those folks and check on them. So that piece is taken care of. The other thing that...
And does Contra Costa have battery packs in case a person needs it? Because it is hard for someone who's dependent on equipment like that to go to one of these recharge places.
I don't believe yet we have the battery that widely available, but certainly it's in our agenda to get those. Yeah.
Okay.
The other
cities might.
is that our hospitals and medical facilities need to be well prepared for PSPS, and PG&E is making a good effort to reach out through the hospital community to have those warnings in place.
Great. And what about the status of if we had an PSPS tomorrow, would those same folks in our, it was different places, but a lot of it was Hills residents who seemed to have the problem with their cell service. Do we know if that has been addressed in this interim period since last year?
Go ahead. I'm sorry, Doctor.
I don't know that. Yeah.
Okay. So I know that the various cell phone companies had plans to address that. The FCC does not require long-term battery backup of these cell towers. So most of them, their battery backups, if they have them, are just a matter of hours, not the potential days that the PSPS event covers. So there have been plans to do that. I don't know. I have not received any updates on which cell towers or which companies have actually made those adjustments and enhancements. My suggestion to residents is to plan to not have good cell coverage during a PSPS event.
Hard when you're being notified to. So there was legislation in the legislature that did put some new requirements in. Unfortunately, I can't remember if they had to have already met it by right now. But certainly I'll have my staff look into it so we can send a blast out to our constituents about that, because clearly that's very much, I mean, one of the biggest complaints we heard after last year's outages was just people that felt like they're just sitting ducks, because when they receive the emergency alert on their cell phone and their cell phone is dead, not charged. So it's clearly an issue, but I will have my staff, we'll do a blast that gives whatever updates we can get on that, since we haven't yet had to have the power outage, but we may.
Yes, and from a community preparedness standpoint, even though Alameda County is in the process of purchasing and Contra Costa County plans to, the reality is that the number of battery backups that the local government will be able to provide to individuals is going to be relatively small, considering the vast number of people who rely on electric power.
Medical equipment, right.
So for those who can afford it, we definitely recommend buying their own battery backups and cell charging batteries, so that they have the ability to be able to sustain that equipment for a couple of days.
Good. Well, I appreciate these updates. We may, I think, have to have another town hall soon around some of these same questions, just because we're going to be in this fire season until November. So we may have another one. But right now I'm going to switch over to Commissioner Lara. And Dr. Walker, Captain Pace, thank you so much. And if you want to stay on, you're welcome, and participate in this next portion. Commissioner Lara, it's so wonderful to see you. Those who are participating in the town hall, Commissioner Lara and I worked very closely together in the legislature on a variety of issues. And so we have a very good relationship and good working relationship. So I'm very glad that you've joined us. And now we're going to talk about a couple of things, and then we've got a bunch of questions for you. Your office took the lead. The Department of Insurance in California took the lead when we had the shelter in place, knowing that people were not driving as much. You ordered auto insurers to rebate customers because there was a decrease in auto usage. You also gave a directive to insurers to not enforce deadlines for claims during this time of the statewide emergency. You eliminated co-pays, costs, and deductibles related to COVID-19 screening and testing. You did a variety of other things. So I'm going to let you just describe some of the things specific to the consumers who are listening that your department did. And then we'll get into the questions that our people asked, many of which do with fires. But go ahead, Commissioner Lara.
Absolutely. It's so good to see you, my friend. I'm glad you're safe. I'm happy to join you today, and I want to thank the other panelists for the great work they're doing. I'm here to discuss some resources for our local businesses and residents, and give your constituents in the East Bay an update on the work that we have been doing on their behalf. Together we have a lot of work to do to assist our businesses and their workers as we continue to try to cope not only with this pandemic, these fires, but also the future of our economy as the state of California. Before we jump into the questions we received about wildfire insurance, I would be remiss not to mention several actions, as you were mentioning, that I have taken to protect consumers during the COVID-19 pandemic. because of the stay-at-home orders, we have seen fewer accidents, as you mentioned, on the road and fewer insurance losses at businesses. And so I did order insurance companies to return a portion of premiums to businesses and drivers affected by the COVID-19 pandemic. This includes both private and commercial auto policies, workers' compensation, other commercial policies that are applicable to both small and large businesses. In fact, I'm proud to say that my actions go farther than any other state insurance commissioner by including our business community in the fold, understanding that our businesses also need some much needed reprieve during these times. And I'm proud to say that because of my order, California automobile insurance companies have given back $1.2 billion
Wow.
to drivers. You heard it, $1.2 billion to almost 18 million drivers on the road in California. So that is hopefully putting some much needed money back into the pockets of our drivers and business owners. I also want to note that if the number of miles you expect to drive in your personal auto will be going down for the near future, or if your payroll and receipts will be down for some time, you can call your insurance agent and amend your policy to reflect those changes so that you're paying less of a premium. So if you are a business owners and you're still seeing those the payroll going down, the number of employees going down, and if you're a private or commercial driver and are still seeing some lag in terms of the amount of miles you're driving, call your agent and let them know so that you can continue to get an additional discount. If you want to see what your own insurance company is doing, you can visit insurance.ca.gov to see the reports they submitted. I've made them submit reports so that we can verify that the discounts they're giving are actually fair and that they're adequate in terms of the policy that you have. It's a good old saying, I trust you, but I got to verify that they're doing the right thing. And my department is currently reviewing all the reports to verify these amounts, again, that are sufficient for our businesses as well. And we're working on calculating how much we've been able to save for our business owners. So we also encourage any business owner to contact our department at 1-800-927-4357 if they have any questions or have not received any type of reimbursement.
So that's your consumer hotline. So you want to say that number again? It's a consumer hotline for all of us who have insurance to be able to check and see whether our insurer is complying. So give that number again, Commissioner.
Exactly. If you have any questions regarding any insurance item or any fraud, if you feel you've been a victim of fraud or seeing something shady within a policy that you don't agree with, call us at 1-800-927-4357. And I'll keep repeating the number because I want you to have that number readily available for you all. So, in addition to the premium relief, Senator, I have taken over 20 separate actions to help consumers. I'm not going to go through all the 20, but I do want to quickly just mention for those of us that we're still working on trying to get through this COVID-19. But as you mentioned, I directed health insurance companies to provide zero copays and cost sharing for consumers for COVID-19 screening and testing. We've also extended policy deadlines for consumers to ensure that they don't lose or limit or waive their policy benefits as a result of this national state of emergency. I've also asked companies to extend grace periods, as you mentioned, so consumers affected by the COVID-19 pandemic have more time to pay their premiums. The last thing I want is people to lose their healthcare insurance during a pandemic because they've lost their job and can't pay their premium. So many insurance companies are extending those grace periods. Again, if you have any questions, give us a call at our department and we can help you through these, through your individual policy. And we've also pushed.
And give us that consumer number again.
Of course, it's 1-800-927-4357. And again, we're pushing insurance companies to expand access to telehealth. So consumers have access to medically necessary healthcare while keeping them and our healthcare workers safe. I want to thank you, Senator Skinner, and the work of the legislature for making sure that those reimbursements are equal to a visit. Because I honestly, I don't know how you feel, but I think telehealth is the future, and it's a way for us to all be safe and continue to provide critical medically necessary services. Of course, we got to continue to work on connectivity, which I hope we would have passed that bill. But we'll be back next year because connectivity is going to be key, especially for those folks living in these remote areas. Again, you can see the full list of our actions at insurance.ca.gov. I quickly just want to go to wildfires.
Yes, let's go to wildfires. A lot of questions about the homeowners who've had their policies either just not renewed, or just give us some things for those homeowners who live in the high wildfire areas.
Yeah, I'll give you a snapshot. Obviously, as we've heard from our captain and our doctor, we're squarely in the middle of a fierce wildfire season that is damaging and destroying homes and businesses. It's the department will be here to help you recover, help you rebuild, and help you along the process. For the 2017-2018 wildfires, the Department of Insurance, our intervention was able to recover more than $240 million for wildfire claimants. So, please come to us for help. After the recent August fires, I immediately issued a notice to insurers requesting that they expedite claims and make advance payments of up to 25% of contents coverage for 4 months of additional living expenses, or ALE as we call it, in the cases of total loss. Plus, we also requested that insurers provide a grace period for policyholders to pay their premium, similar to what we did on the healthcare side. And these actions are really intended to provide consumers with the needed funds to cover their immediate emergency expenses and to start them on the road to recovery. We want them to be able to get a roof over their head, be able to have some living expenses so that they can, continue with their lives, and making sure that their kids have what they need, and then start that rebuilding process. That's critical as we begin. We've heard that some people who were evacuated are losing access to their insurance benefits, that to pay for a hotel or other emergency expenses after just 2 weeks. And even when homes are still, difficult to reach, or quite frankly, uninhabitable due to the loss of water or power or some other environmental mishap that might be underground or severe smoke damage. So last week I issued a notice calling all residential property insurance companies to cover additional living expenses for those policyholders who remain under mandatory evacuation. It's the fair thing to do. It's what we should be doing for every consumer that is going through this unfortunate situation.
So
go ahead.
Let's talk a little bit about the FAIR plan, because we know that some homeowners that they faced where their policy was not renewed. And so the Department of Insurance has put together, it requires all insurers in California to participate.
Yes.
Now, what we've heard from some folks is either they've not been able to get a policy under the FAIR plan, or it's been prohibitive expensive. Can you talk a little bit about that?
Absolutely, Senator Skinner. We are seeing non-renewals with a 600% increase in complaints of non-renewals since 2010. You can imagine now, taking into consideration what this year is going to look like, and premium increases. We've had more than 268 rate increases filed by insurance companies from July 2017 to July 2020. And we are starting to see a severe lack of insurance in the traditional homeowners and renters market. The FAIR plan, as you mentioned, is the insurer of last resort. The FAIR plan must write you a policy, but what we're seeing is that it is coverage that is not comprehensive as traditional homeowners insurance. What you end up doing is you end up paying more for very limited coverage, because they'll only take the fire the fire risk, but then you have to take up what is a DIR, which is additional coverage, where you end up paying additional administrative fees, which just puts another layer of cost on the insurance. And so what I'm asking for, and we're currently in court because the FAIR Plan is suing me, I want them to, in addition to offering their traditional coverage, that they also offer a comprehensive, full coverage homeowners policy, so that people don't have to get that wraparound coverage, and they get one comprehensive policy, like if they were in the traditional market.
Great.
So, you know, we're fighting that in court, and we'll let you know how that turns out. But we feel very confident that, you know, consumers should have the right, as the insurer of last resort, to have one comprehensive policy that's gonna, you know, save you some money.
Well, I'm glad you've taken those insurance companies to court and you're fighting on behalf of our consumers who've really been affected. Now, here's another question that people have asked. How does an insurer, do you regulate, or how is it that an insurer decides that, say, my house is the high fire area? And is there some rules and regulations around it, or do they just get to arbitrarily decide that?
God, there's so many different ways to answer this question, because as you can imagine, all policies are very different. But I have Joel Lauscher on, who is my special counsel, my expert from the Bay Area, who can give us a couple of the examples of what we're seeing. Joel, take it away.
Thank you, Commissioner, and hello, everyone. I actually live in Moraga, just the other side of the Oakland Hills. And we face the same issues, and these are issues people actually face statewide.
Right.
Insurers have full discretion, really, in terms of setting the risk appetite that they want to take on in terms of homeowners business, as long as they aren't unfairly discriminatory. So some of the considerations they have would be whether you have a wood shake roof, or what your protection class is of your fire department, which takes into consideration how close you are to a fire station and or a fire hydrant, the age of the home, other things like that. The commissioner has mentioned before wildfire models that insurers use, and they look at the slope and the density of the fuel and the access to your homes. And the insurer is able to use any one of those risk considerations to determine who is going to be eligible for coverage. And at any point in time, they can change their mind to take on a less risky kind of baseline. And that's how people get non-renewed. An insurer decides to retrench. They don't want to either write as much business as they did in a particular area, or they've kind of decided to set a new threshold so they're not taking as high of risk of writing homes that are somewhere in more brush or less accessible areas. And unfortunately, that leaves the homeowner having to search for coverage. And I will say, we've done a lot at the Department of Insurance under Commissioner Lara's direction to put in tools to help consumers shop for coverage. So if you go on our website under the top 10 tips for finding residential insurance coverage, you'll find that gives you a kind of a summary of how to search the marketplace. You can use our insurance coverage finder locator. That will help you narrow down to find which insurers at least say they're writing in higher risk areas. And we also have the 800 numbers for all of the insurers that write homeowners insurance in California. So when you identify those ones that are willing to write the higher risk areas, we really suggest you contact every single one of them to see if they can give you coverage before you end up with the FAIR Plan. But for the FAIR Plan and all insurers, their premiums are based on loss experience and risk of loss to be actuarially sound. And so we fight to keep them as low as they can be, but still are required to allow actuarially sound rates. So anywhere in our high-risk areas, you're going to find that premiums are expensive.
So say where you find that again on the website.
Yeah, go onto the Consumers tab in the Department of Insurance website.
California Department of Insurance website, Consumer tab.
Right, insurance.ca.gov, Consumer tab, types of insurance, and go to homeowners insurance. Look for our top 10 tips for
Great.
Finding residential coverage.
Great. Now,
It'd be easy for folks to find.
good. Now, we have a lot of people, obviously, that are renters, not insurers. So what does a renter do? Can a renter get insurance for fire coverage or earthquake? What's available to renters?
Great question. And I got Tony Signorelli here from our Consumer Affairs Division who can, we get this question a lot. We often focus on the homeowner, but so many of us that are renters, we have products and rights as well. So Tony, go ahead.
Yes, Commissioner. Essentially renters can purchase insurance and we encourage them to do so for their personal property. The landlord's policy is not going to cover your personal property as the tenant. And so they need to protect their own personal property as well as any potential liability that they may have for living on that property. So the renter's policy would cover liability and theft of their belongings or damage to their belongings. And it would even cover additional living expenses should they have to either evacuate or if their home suffers a loss and they can't, their apartment suffers a loss and they can't live in it. So we do encourage renters to purchase it. It is less expensive than homeowners insurance, obviously, because it's not covering the structure. And so we encourage people to shop around. You could also look on our website for, as Joel Loucher mentioned earlier, that same area and look for those same insurance companies who sell renters insurance and shop around there. Those traditional renter policies don't cover flood or earthquake. You would then have to purchase a separate policy for flood, and you would go to and that's mostly sold through the National Flood Insurance Program, which is run by FEMA. It's at the federal level. So you can go to the FEMA website or the National Flood Insurance Program website and shop around there. And then for earthquake insurance, you could go to your same insurance company that you purchased your renter's insurance from, and they could give you the information as to how to get covered for earthquake for renters through the California Earthquake Authority for your personal property.
Great. Now, we're almost out of time, but I do have another question on the mileage thing for the, so how does the consumer know if they were given the correct discount for the reduced mileage? And some insurance companies are now telling, some of it's self-reporting. I just tell them, okay, this is how many miles I drive average. Others are now asking for a third-party mechanism to determine how much miles I drive, like oil change info, that kind of thing. So what's the rules around that, and how do I know if I got my fair rebate?
Great question. So, we are compiling all that data, and we honestly left it up for every insurance company, because you can imagine for us trying to create one process for all the insurance companies. So you can get a partial refund, you can get a future credit, you can get a discount. So we allowed for the insurance companies to come up with different methodologies. We reviewed those to make sure that they were fair, accurate, and depending on the type of policy you have, because those are also very different. And so if you have any questions in terms of if I have not received a discount, or if you haven't seen a discount on your invoice, you can give us a call. We can call the insurance company with you, and we can find out what's happening to your discount. And by the way, we've ordered that the discount or the partial reimbursement be in place until the stay-at-home order has been lifted. So this is going to continue going on until the governor lifts the stay-at-home order. We want to encourage our folks that can stay home to really stay home and know that, you know, we're gonna do what we can to make sure that the amount of risk that they've lowered, that they're getting compensated for that. Tony, do you want to add anything else to the answer to this question?
Well, I mean, you pretty much said it, but the only thing I would really add is that with regard to verifying the mileage, it's really a mixed bag. Some companies will just give the consumer the benefit of the doubt as to their reduced mileage. Others will require some kind of verification. So that'll be in the plan that we're looking at, that the commissioner mentioned that we're looking at. And if we feel that the process that they've employed is unreasonable, we will call the insurance company on that. But we encourage you, as Commissioner said, to contact us and we can walk you through that, see what your company's doing and make sure it's fair and reasonable.
Great, good. Now, since you referenced again that you are taking these actions on the fires because we are in a high fire state and fire season, but around the things like getting us rebates on our auto insurance and some of the other items, and making sure that our COVID-19 tests are covered by our health insurers. Those things you're doing because we are in the midst of this pandemic. And as you pointed out, Commissioner Lara, you want everyone, your department is trying to make sure that we're all staying as safe as possible, that those of us who can stay home or work from home are, as has been asked of us, and that's reflected, because we're not driving as much, it's reflected then in what we're paying. Now, I say all that because the other thing, obviously, that's on everyone's mind is my health insurance. And because so many people are unemployed, what they may have gotten before through their employer for health insurance, they're not getting now. So clearly in California, they have the ability to use our exchange, Covered California. But will that be available to them? You know, historically, there's a window when you can enroll, but nobody knows when they're going to get unemployed or when their health insurance may run out. So will that stay available? What else is happening there?
Yes, absolutely. And and Covered California has actually extended their window because of COVID-related enrollment, issues entirely. I think the period was extended to the entire year of 2020. The current special enrollment period extends, I think, from August 31st to November 1st, and then through January 31st, 2021. So if you've lost your health insurance coverage, you may qualify for the special enrollment period. But again, the idea here is if we need to extend those enrollment periods, we will do that, because we want people to have healthcare during a pandemic.
Yes. So clearly, the good news there too is obviously some people may be hearing this and thinking, wow, I'm unemployed. How am I going to afford it? That when you go to Covered California, not only can you apply for health insurance through a health insurance carrier, if your income is dropped, you also can apply for Medi-Cal there. And we have expanded Medi-Cal also. So Commissioner Lara and the other staff from the insurance department, and of course, Dr. Walker, we've pretty much run out of time, but I want to just give you each, if there's anything else you want to communicate before we wrap up this town hall, please, the floor is yours. Commissioner Lara, Dr. Walker.
Thank you. I would just say again, look, I know insurance can be complicated and it's the last thing you want to deal with. But, again, for those folks that are going through the fires right now, that are business owners and trying to struggle to understand their policy as they try to maintain keep their doors open to run their business, we are here for you. Give us a call. We have people answering our hotline that speak multiple languages. In whatever language you feel comfortable, we're here to walk you through. This is what our job is. And my job is to make sure that I make the resources available so that we can help you rebuild. We can help you keep the doors of your businesses open. And I talked about today, get you some money in your pocket so you continue to move on and until we get out of this pandemic that we're in. So again, please give us a call at 1-800-927-4357, or you can reach us at insurance.ca.gov.
Great, and that's the insurance hotline for the California Department of Insurance, and that is our elected insurance commissioner, Commissioner Ricardo Lara. Thank you, Ricardo Lara, and thank you, staff. Dr. Walker, is there anything you want to say as a wrap-up?
Yes, my last message is flu season is coming. Get your flu vaccine
Thank you for that.
this year. Go to your provider, your health provider, go to your pharmacy, but get it done early to avoid a concurrent flu breakout with the COVID situation.
Thank you, Dr. Walker, for that reminder. Yes, and just in terms of timing, when you say get it soon, is that now? Is that a couple weeks from now? What's the advice?
We ordinarily say in October, but we're actually encouraging people to get it early this year. And
Flu vaccine.
It's available. Yeah.
Okay. All right. So that's a great message to end on. We don't want COVID and we don't want flu. So for COVID, wear our masks and take the other advice that we've been given. Keep your social distance, stay with your own family or friend bubbles. And of course, for flu season, get that flu shot and go to the Department of Insurance's website so you can be helped on any insurance need that you have, whether it's business or personal. Thank you all. This is a wrap. I'm Senator Nancy Skinner, and my great staff put together this town hall. We'll do more. Thank you all. Bye.
Thank you.
Okay.